Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hi guys, Dr. Santhosh here, your pediatric infectious disease doc and researcher.
And this is Praz the Sandman, injecting my thick white solution across the radio wave.
Oh, that's so terrible. Let's hold off on any thick white eruptions over there, Sandman. And with February drawing to an end, welcome to spring. And, it's been a few years now since we've started this, Santhosh.
On a wing and a prayer.
We did have a few sound issues early on as we were cutting our teeth in the world of podcasting.
Yeah, that's what it sounded like.
Or didn't. It seemed like the perfect time to come back, retouch a bit on an older topic, and do another Around the World in 80 Plagues.
I've heard so much about this. I'm very excited.
The very first time we talked about the plague of today, which is going to be rabies, it was in the context of a vacation. And the last time you would have heard any of this, Praz, it would have involved somebody who is very well known to the podcast. We have him as a guest today. May I introduce you both to the infamous, the delightful, my favorite friend, Koh.
Yay!
I do exist. It's a pleasure to be with you guys.
For those of you at home, Koh does have a first name. I just never use it because we've known each other for far too long. He also calls me by a lot of things that we can't repeat on the radio. Koh, you had a very unique experience when we traveled to India that makes you the best person to introduce this episode on rabies. So why don't we start off with our anti just the tip and hear from you firsthand. What happened in India?
Yeah, so I'll stand for all the country bumpkins out there. Representing NorCal, I went to a travel doctor in Oaktown, and this travel doctor is about to go out of business, the travel clinic. Took it upon herself to scare the crap out of me with regard to rabies risk. She's like, oh yeah, if you get rabies, you'll die, so you better not get it. And so she explained that, yeah, you'll need to get, you can take that series of 4 shots before you go, or you can just take the shots after you get back if you get exposed. And so I had that in the back of my mind, like, stay away from dogs, stay away from monkeys. So we go off to India, we have all the tetanus shots and the Hep A, Hep B, or whatever all the travel doctor shots are. And so I did get a rabies vaccine. But due to the warnings, I was overly cautious. Well, I wouldn't say overly cautious. I was just trying to take natural precautions.
So wait,
And so, yeah.
oh, you got a rabies series, so it's usually not just one shot prophylactically.
Yeah, I didn't get. See, that's the thing. I did not get the series before I went.
Gotcha.
So
okay.
I think what that did is, if I got the series before I went, from what I understood from this wicked travel doctor, then I would have been okay. But I didn't. So I think, I might have gotten 1 shot, which was useless, or I might have gotten no shots. I don't remember exactly what happened. All I remember is that we wound up in Nepal, and my arm wound up swollen because I had to take the series starting in Nepal.
No. And now that we've buried the lead a little bit, so folks, you know that this is going to end in needles and pain, but let's get to the fun part.
The part that Josh has told and retold is we were at a temple in Jaipur. So if you've been to India, Jaipur, I believe, is known for its silk. One of the places he took us was a monkey temple. And these monkeys, they weren't the friendliest. They had scowls on their faces. There were quite a few of them. And somebody, one of the temple custodian, gave us some like pellets of some type. I don't remember what it was exactly. But the idea was to use them to feed the monkeys. And so I'm like, okay, this sounds reasonably fun. And then so Crystal, Ward, and Josh, they all followed instructions. They kept the pellets out of sight of the monkeys. But me, being somewhat klutzy and inattentive, had it exposed in my hand, and I was wearing short sleeves. One of these less polite monkeys jumped at me, tried to get the food out of my hand. So that's why the custodian had told us to keep it under wraps so that they wouldn't do that. But I had left it exposed, so they came after me. And so what wound up was I got scratched on my arm, I got scratched on my neck, didn't draw blood, but this is where a travel doctor scaring me. If it's just contact, that's okay, but she said if they scratch you and there's red marks, you should get the series right away. And so we're in Jaipur, and the first suggestion was to take a train 5 hours to Calcutta to get the series started. So I'm going back and forth, and then I call a clinic in Nepal because that was our next stop. The Nepal person says the same thing. Meanwhile, I'm traveling with two doctors here. So Ward and Josh are both like, don't worry about it. You're just too nervous, Nelly.
Oh.
And I'm like, all right, so I have two doctors that I don't trust.
In case you're confused, he's referring to Ward and I.
Yes, yeah.
Well, I trust Ward, but the fact that Ward agreed with Josh, that was a bit of a downer. So I'm like, all right, so let me get a third opinion. Let me get a fourth opinion. So the Nepal travel clinic, they're like, be cautious. Obviously, they have a conflict of interest because it's a $1,500 shot.
Whoa.
But so the Nepal travel clinics, you should probably be cautious. The travel doctor in Oakland, you should be cautious. So I'm like, all right, better safe than sorry. I certainly don't want to die in 2 days. I wound up we didn't go to Calcutta. The Nepal clinic person said, or the doctor there said, all right, you can probably wait a day or two, but I was nervous the whole time. I was staying at least 15 feet away from all dogs. It ruined at least 2 days of that trip, all because of a couple of monkey scratches. And so the kicker is that Crystal, who's with us, she tells me after I get all the shots that she also got scratched, and she decided to do nothing. And she's still alive. So I guess that validates my fear, or that I was way too.
$1,500 you ever spent?
Yeah.
Now the thing is, I got reimbursed by travel insurance. So,
nice.
and all it was a wash.
Yeah.
I strongly encourage you to go back and listen to our early episode called Bite Club. A couple minor corrections or additions to Ko's telling when he called this travel nurse. The first thing he did is he did ask both myself and Ward, what should we do? And we said, this was an unprovoked attack. The monkey just grabbed for your nuts, the nuts that you were holding in your hand, the bag of them. And that was why. So the monkey made a grab for the bag of nuts that had been handed out to each of us. So the monkey grabbed for Ko's nuts and missed, scratched him. He told that perfectly normal. The real beauty of this was in the retelling, because as Koh has said, he was somewhat anxious after this. And as we met, he's a very friendly guy, and we kept coming across people, and he would sort of relay this story to them. And each time, the monkeys got more and more aggressive, moving initially from, I was clumsy and this monkey scratched me, to, I don't know, they were all scowling and they seemed pretty violent, to a couple monkeys attacked me. And by the time we hit Nepal and he was telling the travel doc, it had almost blown out to the proportions of, there I was, surrounded, monkeys to the left of me, monkeys to the right of me, all of them wearing jackets and switchblades. When one of them stabbed me right in the knee, I fell down, I got mugged, they urinated all over my wounds and said, now you're gonna get monkey AIDS. I'm paraphrasing, of course, but the first travel nurse, when he refused to believe Ward and I, Ward placed a call to...
Refused to believe us.
Koh, you didn't believe anybody.
No, your grammar was incorrect.
Yeah. He was fixing your grammar there.
When Ward and I called Santhosh,
that's correct,
and Santhosh also said, he's like, here's some of these things. That also wasn't going to be good enough for Koh, so we both contacted our respective infectious disease departments, all of who said, there are some risks, but if it was an unprovoked attack, and we'll talk about that later, it's probably okay. The travel nurse was telling him, get on a train 5 hours to Calcutta and then fly to Australia where they have this serum. And it was actually Ward and me who were telling Koh, we're going to be in Nepal in a day or two where they have this clinic, just wait. And initially, he didn't want to wait. Eventually, we did convince him, grumbling and upset and just generally not trusting of us the entire way. A a state of mind which he has remained in for the last 30-some-odd years that I've known him.
Sure.
It should have been a Ward and I the time you just did. But I will say, I will give you credit. I did forget completely about the Australia thing, and you are actually correct. So, yes, that was kind of crazy.
Wow. Okay.
This is the beauty of keeping a travel journal, because I did actually write all of this down.
Yes, that is kind of amazing, actually, yes.
So we get to Nepal, and being a good friend, but at least in Ko's opinion, a terrible doctor, I accompanied him to the clinic, went through the whole series of shots, and he got one series of shots in Nepal and then flew back and completed the rest. Now, Ko, would you agree that you had, on occasion, perhaps embellished the aggressiveness of the monkeys in subsequent tellings?
Not to the degree that you just did.
But it was getting up there.
Possible. It's possible. I don't think I did. But all I can say definitively is I don't like monkeys.
It's a very fair thing to say.
We're going to go back and talk about this temple and some things a little bit later at the end of the episode as a recap of our Just the Tip. But why don't we get into actually talking about rabies? I'm going to start off with history about the rabies virus. It has been known for many, many years. And when we're talking many, this goes back well into ancient history. AD 79, Pliny the Elder, one of history's first historians, included in a list of rabies cures a recipe for inserting the ashes from a biting dog's tail into the wound. So in theory, if a dog bites you, you pluck some hairs off that dog's tail and you burn them and you smear those ashes and hair into your wound. And this is actually where we get the origin of the phrase, the old hangover cure is hair of the dog. You get a little bit of hair of the dog that bit you.
That's the hair of the dog.
Yeah, so the hair of the dog is actually, even though now we use it to refer to a hangover cure, originally was meant to be a rabies cure dating back to ancient Greece. It didn't work. Shocking, I know. Now, another fun little bit of history, the Artha Shastra by Kautilya, and that's around 4th century BC, tells how to make a bunch of different kinds of poison arrows, and one called for mixing various toxins with, the arrowheads and dipping them in the blood of a angry or rabid dog or a rodent, and they say anyone pierced with this arrow will be compelled to bite 10 companions who will each in turn bite 10 more people. The implication, of course, being to historians that muskrats and dogs were vectors of rabies in India even back then.
Sure. Wow.
It sounds like it's some kind of zombie virus, like compels people like bite and eat each other.
Well, this is a lot of the fears of zombies did come from versions of the rabies virus, and even the movie 28 Days Later said they based their speedy zombies and the rage virus on a mutated form of rabies.
Oh. And that makes just a ton of sense, because you do have this very slow change in behavior that looks like you are mentally and behaviorally deteriorating until you go from human to sometimes, not always, crazy person or possessed person to, if you last through it, if you're not killed by somebody, comatose, and then, finally dead.
You sound like my travel doctor.
Yeah.
Actually, I did have a question.
Yeah.
So when you go through like that stage where you start to deteriorate, my understanding that's actually a fairly accelerated process. It happens very, very quickly if you're not treated. Does that vary in terms of the lead time?
Really, really fast, yeah.
When it starts, yeah. When the symptoms start to happen, they progress very quickly, but they take a long time potentially to begin, and we will talk about that a little bit. And this is why Ward and me were both counseling.
Aye.
Yes, that's why we know you. The beauty.
I'll give you a grammar lesson offline, man. Don't worry about it.
The real beauty of this is that he doesn't realize I'm purposely using the wrong one every single time consistently, because I know his level of grammar.
Oh, so mean.
So, if we move forward, one of my favorite theories for rabies was in, of course, the Victorian era, because when else would it be? But in the 1830s, a British lecturer put forward the theory that rabies was spontaneously generated in male dogs that are kept from having sexual intercourse.
The opposite of an STD.
Some high muckety-muck in Victorian Britain basically said rabies is because of blue balls in dogs. This also was not true, but the first person to really study it was Louis Pasteur, and that was in 1885. So Louis Pasteur, we of course all know from pasteurization, but what you probably don't know is that previously he worked as a chemist and biologist, working a lot with animals. He had created 2 vaccines before he began his more well-known work. The first vaccine was for chicken cholera, the second was for bovine anthrax, and because of these zombie-like appearance things that we've been talking about, Victorian England was terrified of rabies. They didn't know how it started. They only knew it transmitted from bites, and it caused rapid changes and violence and no cures. So Louis Pasteur decided his third animal vaccine was going to be trying to treat dogs for rabies. And he chose to work on it specifically based on that terror. He kept kennels of mad dogs to test it on. And then one day, parents of a 9-year-old boy brought their son to this clinic with Mr. Pasteur, and they said he had been bitten by a dog who they worried had been violent. Would he please do something, anything? And he basically said, well, I've only been testing this on animals so far. And he initially resisted, but they were just so desperate that he eventually agreed. And that boy not only survived the shot, but grew up to become the janitor at the Pasteur Institute and continued to hold Mr. Pasteur in high esteem until the day that he died.
Wow.
So this was, and the very first vaccine, which you might be interested to know, it was developed by 2 people, Louis Pasteur and his assistant, Émile Roux. The grad students never get any credit.
No.
Their original vaccine was harvested. Their original vaccine was harvested from infected rabbits, which the virus in the nerve tissue was weakened by allowing it to dry for 5 to 10 days. So it was just a weaker version of the live virus. That's what we call an attenuated vaccine these days. And some of these nerve tissue derived types vaccines are still used in some countries as they're much cheaper. But keep in mind, he took this vaccine, he injected this boy with basically very weak version of rabbit rabies. Now, if you're wondering, well, how bad could rabies be in a rabbit? I would like to refer you to Monty Python's Search for the Holy Grail. The scene with, that's not just any rabbit, it's the most vicious rodent alive.
I love that rabbit. That rabbit just rocks my world.
So now that we've talked a little bit about the history, and we know the transmission is spread when an infected animal scratches or bites another animal or human. Now, interestingly, this is one of the diseases that saliva from an infected animal can also transmit rabies if just the saliva comes into contact with the eyes, mouth, or nose. Usually when we think about transmissible diseases, we're worried about blood transmission, skin transmission, but this is one of the few that transmits through saliva, and that's why the bites are so dangerous. Now, bites from mice, rats, or squirrels rarely require rabies prevention because most rodents who have rabies are usually killed by any encounter with the larger rabid animal. You know, if you have a rabid dog or a bear or something, it's not going to just bite a rat and walk away. It's going to murder it.
Yeah.
Transmission between humans is also pretty rare. The only documented cases of rabies from human to human has nothing to do with bites. It was 8 people who received transplanted corneas and 3 people who received solid organs, I believe 2 livers and 1 kidney. And these were all from people who had been carrying the rabies virus when they died, and it was not known that they were infected when their organs were taken from transplant.
Right, and Josh, we should say that didn't all happen like on the same day.
No, that'd be a terrible day.
There are cases that have been recorded, so when we get into transplant infectious diseases, we are always very alert when the donor has any history of altered mental status, meaning that they are behaving differently or having trouble thinking, or they became slowly comatose. Any of this kind of higher neurological function, if it deteriorates this way, we do think of rabies as one thing that's going on, but there could actually be several other types of infections or toxins, and that therefore should make them not a good donor. So we take them off the list if we hear about anything like that, and we'll even cancel organ donation if, in the midst of transporting an organ or something like that, we get a report like, oh, donor had altered mental status.
Not attributable to any other cause, like obviously they had brain damage or something.
Well, yeah. I mean, if they were slowly deteriorating and they had a massive head injury and that's why they're donating, yes, I can agree with that, Praz. But if they had, kind of any reports that they had slow deterioration over a course of time, even if the cause of death is completely unrelated, like trauma, then we do go back and say, oh, there's something suspicious in the history. It is really, really rare for something like this to happen that you're talking about, Josh. And usually it's not even a consideration because the need for the transplant is so much more imminent than the risk of something like rabies. So it's that rare. But we always keep it in the back of our minds if the donor has altered mental status.
Now that we've kind of talked a little bit about the etymology, let's move on briefly to the epidemiology, and then I'll turn it over to you, Santhosh, because of course, as our infectious disease doc, you're going to be our go-to expert, and it has the added bonus of Koh will actually trust you.
Oh yeah, definitely.
So rabies is caused by the Lissa virus. Now, rabies itself is Latin for madness. This may be related to the Sanskrit word rabas, which means to do violence. And the Greeks used the word Lissa from lewd or violent. And Lissa was a Greek deity, a Greek god who basically was in charge of madness. Lissa was the one who caused Hercules to become mad with rage and murder his wife and child. She also came across the hunter Actaeon, who spotted Artemis bathing naked in the lake, and Lissa inflicted the hunter's dogs with rabies, and they became mad and tore him apart because you don't bathe on women if they don't know you're there. That's just wrong. So Lissa virus literally means enraging virus. So a little bit of Greek history for you. Now, who really is transmitting rabies? Of course, the most common carrier around the world is dogs. But in America, we really haven't seen any dog cases, aside from a few scattered ones, since about 2007. And the major carrier in the Americas is bats, which is why I believe Batman's ultimate enemy is really himself, because Batman would 100% have gotten rabies over the course of his crime fighting. And we'll talk about that and why a little bit later. But about less than 5% of cases in America are from dogs. Around the world, dogs are the most common carrier. In the Midwest, skunks are the next biggest carrier. And in the northeastern U.S., it's raccoons. Now, a lot of countries have taken different approaches to try and eliminate this, and we'll talk about that a little bit more later. I just want to mention that my absolute favorite is Switzerland, because the disease has been virtually eliminated after scientists placed chicken heads laced with the vaccine all around the Alps. They just scattered chicken heads, and the foxes, who were the main source of rabies in Switzerland, ate the chicken heads, immunized themselves. So that's my fun tip of the day. But Santhosh, tell us about the pathophysiology. What are the signs and the symptoms of rabies? How long does it take to take effect? How much concern did Koh really need to have?
Sure. So, number one, we should focus on the primary vector in rabies, which is the bite. It's saliva. That's really where the rabies virus likes to hang out, and it gets transmitted from saliva through a wound into bare nerve endings, where it does something very, very strange. There's a few few viruses that do this, but it will piggyback on the retrograde, meaning moving backwards system of a nerve, and it'll start to move backwards. Usually the pain signals do go up, your arm, but usually the way that you move your arm is that an impulse comes from your brain and spinal cord down to the muscle and you move it. But here it piggybacks and starts moving backwards. And it'll go up, backwards, up to the spine. This sounds really creepy. It's like an earwig type of thing. The virus will move backwards. It'll get into the central nervous system, through large nerve roots, up into the brain, and then it will start to work its really dire magic. And you'll get to the final stages, which is, kind of that crazy insanity, and then death.
Well, I'm gonna interrupt you just briefly to put some time frames on these,
yes.
as long as you're talking about.
Yeah.
So the period between infection and the first symptoms,
Sure.
which is what we call the incubation period, is usually anywhere from 1 to 3 months.
Sounds like you're hatching something. Yes.
Yeah, so it's usually about 1 to 3 months in humans. Now, this period has been as short as 4 days and longer than 6 years have both been documented, depending on where the bite is and how deep the bite goes, the amount of virus introduced. But typically it's about 1 to 3 months.
And you can imagine that this is variable, right? Because say something bites you on your toe. That's a long way for Lissa virus to travel, all the way up through your toe and leg and get up into your brain, versus if you're bitten higher up, say, up on your arm or your shoulder. And the other issue which really confounds this is, Josh, you were talking about bats that like to transmit in the Americas. Well, it turns out that the bite of especially the vampire bat, or many species of vampire bats, are anesthetic. You don't feel anything. So a lot of the time we actually don't know when the virus was introduced.
So you're telling me that we could also call Praz Batman as well as Sandman?
We totally could.
I am definitely using that as my next introduction.
We could. There are so many blood-feeding creatures out there that put some anesthetic into the skin so that the victim doesn't know that they're being fed on. But vampire bats are one of them, actually. Whether they're feeding on a cow or a human being, their saliva contains just a little bit of anesthetic. They don't suck the blood up like you would typically talk about. They make a small puncture wound. Their saliva provides a little bit of anesthesia on there so you don't feel the poke. And then they lap up the blood a little bit like a dog drinking water from a water bowl.
You wonder, why is this incubation period so long? How fast does this virus really travel? Surely someone must have studied this, right? Well, good news, they did.
Yeah.
And this was actually published in PLOS. So, Santhosh, I know you love PLOS One. This is PLOS Pathogens, which is an open access journal.
Right, we should pronounce it properly. It's PLOS.
PLOS.
Right, PLOS.
Now, they did a study, and this was way back in August of 2014, and managed to actually quantify that the average speed, with some minor variations of the rabies virus, it moves at about 8 centimeters, which is a little bit more than 3 inches a day. So, again, if you get bitten on your foot, it's going to take a lot more than a month when you're only traveling 3 inches a day.
Right.
Most people are taller than 3 inches.
Exactly.
I mean, I guess midgets might have a shorter course, but...
Oh, God. You're going to get us in
I don't know,
trouble,
man.
little people.
You want me to start challenging your math now, too? So 72
goodness.
divided by 3
There
is
you
about
go.
a month, bro.
Crunch it, Poe. Crunch those numbers.
up to 3 inches a day, Ko. And you also have to keep in mind, the nerves are not taking the most direct route. Like, your nerves are not laid from the top of your head to the bottom of your feet in a single straight line. There are multiple branching pathways, and it has to jump from nerve to nerve. There's not one nerve that travels, with the exception of your spinal cord. There is not a single nerve that connects from your brain directly. There are stops along the way.
Back when Santhosh was saying that at least from monkeys, it's mainly in the bite and through the saliva.
Oh, through
So
pretty much any animal. I can't.
Oh,
think of
any, yeah. So even if it's a bat, yeah. So let's say it's a bat.
Sure.
So when my travel doctor or any other doctor says if you get scratched and it draws blood, is the risk there because they've licked their hands or something like that, or is there also alternate methods outside of just the bite and saliva?
Why can it be transmitted through a scratch?
That really is a theoretical risk. I don't think it's ever been really documented. But yeah, the animals are sticking their hands in their mouths all the time. But the truth is, we don't know how long the virus can last just kind of sitting on a paw or a claw. So it actually really doesn't like sitting out on bare surfaces. It is not like, for instance, the flu virus or other cold viruses, which can last on surfaces. And, this is why we tell people don't wipe your nose and then touch a doorknob or something like that. Because, you can transmit it this way. This is a rather labile virus. It when it's exposed to air and open surfaces, if it's not within a liquid like saliva or getting into the bloodstream or traveling inside of a body, it tends to be rather fragile. Really,
I learned something today, Doc.
Yeah, so it really is a theoretical risk, but I think that more than anything, what the physicians were thinking was, oh, this guy told me that he got, attacked by a monkey, he was scratched. It may have been that he got bitten and he didn't notice. And that's a very, very fair assumption for someone to make in the case of a young man in Texas who died of rabies. And when his family and he was asked about any exposure to any animals, they said no, he wasn't bitten, nothing happened. But it so happened that he woke up one night and there was a bat that had flown in through an open window and was just kind of flying around. And nobody thought of that as an exposure because it didn't land on the kid or it didn't bite him or anything like that. But again, it was an encounter with an animal that we knew carried rabies. So we do have kind of a high index of suspicion when someone says they were touched or scratched or attacked. If the patient is worried, or if they're in an endemic area, or if it's a high-risk animal like a bat in the Americas or a skunk, then we'll say, I don't care what you said you encountered this animal, we're going to give you the shots.
Once symptoms actually start, death usually occurs 2 to 10 days after the first symptoms. The second stage after the incubation period is known as the excitative stage. That lasts about 3 to 4 days, or it's also known scientifically by another name, which I think is way better, the furious stage. And this virus, once it reaches that point, moves fast and furious.
And the reason
How long have you been waiting to say that one?
Yeah.
About 3 years.
The reason for this is that it is moving through nerves which are capable of a lot faster transport than the peripheral nerves.
What are the chances are that somebody who is infected could spread it through sex or kissing, for that matter, if their saliva got infected?
So by the time it gets to a human being's saliva, you're pretty much going to steer clear of them, I would hope. They're not one of the...
Praz, would you have sex with a zombie prostitute? Because that's effectively... You're right. Yes, it could be transmitted through semen and vaginal fluids. That is possible. But in order to achieve that level where it could be infected, that person would be literally trying to tear out your throat.
Right.
Huh.
And so this isn't one of those
50 shades of gray aside, it's going to be a really difficult transmission.
Oh, you like to nip, huh? It's not. It's
Didn't that happen in The Walking Dead?
No. This is old Yeller style, and the truth of the matter is, a human being, unlike an animal, they're going to get agitated and combative, but they're not going to get in a phase where they're going to come after you and bite like a mindless person. they're going to fight and kick and kind of scream in that kind of a thing. But in fact, their motor nervous system, probably by the time that the rabies virus has gotten to their saliva, has migrated up and then gotten into their salivary glands and is excreting, they're probably going to have problems with paralysis and rigidity. They're not going to be able to attack you or bone you very well.
I'll bite your kneecaps off.
They're going to be more twitchy and angry than like screamy zombie.
We talked about some of the symptoms, Santhosh. You know, we of course see non-specific things like fever and headache. What are some of the other symptoms?
Right, so we should actually distinguish two different types of rabies. There's encephalitic rabies, which is the classic presentation, and the second one I'll talk about is called paralytic rabies. So encephalitic rabies has kind of a host of things that go along with it, which are very classic of what you hear about in stories or what you see in the movies. So one is hydrophobia. If people try to drink, it's about in 33 to 50% of patients, they feel like they're going to gag or choke, and you give them any liquids to drink, and instead of soothing their thirst, they'll go and they'll gag and they'll say, I don't want anything. Also progress from there to actually aerophobia, where if they feel a draft going down their throat, like if it's a windy day or a breezy day, they'll get pharyngeal spasms. And this is all from the motor nerves in their throat that control these muscles that help us swallow and breathe. They spasm involuntarily. The facial muscles contract, and that's that trismus, that's that rabies grin, and this is called opisthotonos. I always get it wrong. We hardly ever say it.
It looks like a rage face.
Right. You're smiling, but you're also enraged kind of thing, and you can't control it. The autonomic nerves, in about a quarter of patients, you'll have instability there, so you'll be over salivating, that's the foaming at the mouth, lacrimating, so you'll be tearing, sweating, you'll have goosebumps all over your skin, dilation of the pupils, almost like you're on Molly or some other drug. And then people will complain early on, and it'll get worse and worse, of the nerves that take care of your eyes, your mouth, your throat, just deteriorating. So problems with your jaw, problems with your eyes, vertigo, so they'll have trouble keeping their balance. And then finally, it'll go to agitation and combativeness about half the time. But the other half the time, there'll be no agitation or combativeness at all, and they'll go into either hyperexcitability or disorientation, which means, you know, any little thing will set them off or freak them out, but they'll just kind of twitch, and that'll go to hallucinations and then coma, and it'll go to calmness and death. So these are all of the steps where, you know, they'll kind of deteriorate, and then they'll get finally vascular collapse, so the nerves that try to keep our blood vessels nice and toned so that blood flows to our vital organs, that collapses kind of like like a blown tire. That's 80% of people will follow this kind of encephalitic pattern. The paralytic pattern is a little bit different. Guys, you guys know about Guillain-Barré syndrome, ascending weakness?
Yes.
Where you'll get paralyzed. So, Josh, this is kind of interesting. As the rabies virus travels up the nerve, rather than this phase of like prodrome where we see nothing and then they go into an encephalitic phase, they will look like Guillain-Barré. They'll have ascending weakness. And they won't have like the cerebral involvement where they'll have this, you know, rage and agitation and stuff. They will look like they're just getting weak until they get so weak that they get comatose and die. And for the world, you know, they might just have Guillain-Barré. And if you didn't think to look for rabies, you would never know.
Now, one of the things you mentioned in the hydrophobia, the leading theory for the cause of this hydrophobia has a lot to do with the fact that the virus multiplies and assimilates in salivary glands for the purpose of further transmission through biting. So if you didn't have hydrophobia and you could drink saliva and water and all that, well, if you're swallowing your saliva, which you do involuntarily and naturally throughout the day, the virus is going into your stomach where your stomach acid will kill it. So this hydrophobia is the virus hijacking your own body to prevent you from getting any kind of fluid, and therefore the saliva gets out. So that's sort of the leading theory. It has not been 100% proven, but the physiology works out.
It's ingenious. This is one of these, almost parasitic organisms which knows exactly how to hijack its host.
How do you detect this, prior to the foaming at the mouth stage? When you worry about it, you're looking for provoking attacks, because animals won't always be straight foaming at the mouth. They may just be more aggressive or more likely to kind of run up and scratch somebody. Or if you catch someone who's being more aggressive, they do an autopsy and they look at the brain, and that's great. There's a type of cell that you'll see in the brain called a Negri inclusion body that is 100% diagnostic for rabies infection, but only found in about 80% of cases and only found on autopsy. So not an ideal test for humans.
No. You want to avoid post-mortem diagnosis as much as possible, which is the first thing we learned in medical school. Yeah.
So, Santhosh, how do you test for rabies if you suspect it?
Right. So the main tissues that we go for are saliva, skin biopsy, and then actually testing either the serum or the blood or the cerebrospinal fluid. Those are the three types of samples that you want to go for. And we go with antibody testing for one modality, so to see if you're generating antibodies against the virus, and that's usually in the cerebrospinal fluid, and that's usually done through a lumbar puncture, or in the serum. The other modality is called polymerase chain reaction, or PCR, which amplifies the genetic material of the virus in a test tube so you can detect it and confirm its presence that way. It's really, really bad if it's already detectable in the saliva, and it's really, really bad if it's already detectable in a skin biopsy, where we actually take the posterior region of the neck at the hairline, because as we were talking about before, the rabies virus does move retrograde or upwards through the nerve fibers, and one of the areas where it prominently passes through is the nerves that go right under your neck and through the scalp, and then ultimately get to the brain that way. So we have just a punch biopsy that you take, which is a full thickness skin biopsy.
And that doesn't mean you sock the patient in the face and then get their blood.
It's 5 to 6 millimeters in diameter, and the sample actually is really, you have to be really careful to get at least 10 hair follicles, and the reason for that is because the cutaneous nerves run right by the hair follicles, so that's a great place to do it. We place it on sterile gauze, and then we take it off to actually detect the virus in there, both by PCR and by labeling the virus with antibodies under a microscope, and they'll actually light up with fluorescent antibodies if they're present. Now, the problem with these
And this method of testing is known as FAT, not pretty hot and tempting, but actually FAT for fluorescent antibody testing. So they glow with if it does have rabies.
Right, exactly. And that is a technically kind of difficult test, because there is things like background fluorescence and things like that, so a skilled microscopist has to do that properly, whereas PCR is a little less technically demanding. You can literally grind up the tissue and put it in, and you run the detection, and if it's positive, it's positive, it's negative, it's negative. The problem with all of these is, though, if it's detected, and if it's detected especially in the saliva, it's too late. It's, as far as we have gotten technologically, we've noticed or noted that about 100% of people who've been diagnosed with rabies at this point die. The truth of the matter is, the best diagnosis is a clinical diagnosis before any symptoms have ever shown up. Meaning that a person has come to you saying that they've been exposed to an animal that is likely to carry rabies, and they have or have not been vaccinated, and they have their vaccination history, and you respond immediately by giving RIG, which is rabies immunoglobulin or rabies antibody, and vaccine.
This is because occasionally rabies immunoglobulin and the vaccine can be effective in preventing the disease. One, if the person receives treatment before the start of rabies symptoms, and treatment after exposure can still even prevent the disease if administered promptly, and promptly means usually within about 10 days of infection. So the first thing we say is always, same as with any cut, any wound, you want to wash and bite any scratch, or you want to wash any bite and scratch. You don't want to wash and bite it.
No.
You want to wash. You want to wash any bites or scratches for 15 full minutes with soap and water, iodine, or a detergent to reduce the number of viral particles. Then, Koh took the pre-exposure prophylaxis, which is usually 4 doses, sometimes 5, over a 14-day period. Now, post-exposure prophylaxis is a little bit different. Koh, you actually got the post-exposure prophylaxis. Why don't you tell us a little bit about that? What did they do?
Oh, you mean the one in Nepal? Is what that was?
Yeah, what did you do in Nepal and Oakland?
Yeah, so the thing is, I don't think I got the pre-exposure.
Right.
Correct. That would have been what the travel nurse recommended, and you said initially, no, I think I'll be okay. I'd rather take my chances. And then what you did is you got the scratch and you went for post-exposure.
That is, they stuck a needle in me and they were injecting a bunch of liquid, which I assume is the RIG.
Right.
And it was like 1,500 cc's or some crazy amount like that. And it basically created a massive bulge right around my forearm, elbow area.
Yeah. Oh, no, sorry. That
was kind of, I felt a little misshaped. To say the least. It was kind of weird.
I have a picture of it, and I actually have a surprising number of pictures of Koh's injuries because I like to document him on our trips.
Oh boy. Uh-oh.
So this is important to note though, because so what we say, and it sounds almost a little espionage, but you want to infiltrate the wound with immune globulin. So you're taking the needle and you're trying to get as much immune globulin right around that wound as you can, because you want it to act right where the virus is entering.
Right, and that's why in Koh's case this happens to be injected into the arm, because that's where he was scratched. So the first dose, as much as possible of the RIG, should be injected around the bites, with the rest being given by a deep injection at a site distant from the vaccination site. So you want to kind of cover all your possible entry points. The first dose of the vaccine is given as soon as possible after exposure, meaning within that 10 days of infection period, with additional doses on days 3, 7, 14, and potentially 28. So if you received the pre-exposure vaccination, you don't get the immunoglobulin, the RIG. Since Koh had not received pre-exposure, he did get the RIG and then the remaining 4 doses. Now this happens to fall in between his being in Nepal and his returning to the West Coast, and that's why the remainder of those shots were in Oakland, and those would have been the rabies vaccine. So what was that like? Where did those shots go? How did they feel?
Frankly, I don't remember. All I remember is that that travel clinic went under. They closed down right after. It seemed like a pretty typical shot.
Aside from putting it at the site of the bite, usually the vaccination is given in the deltoid shoulder area. It used to be given in the gluteal area, which is, of course, your behind. Now, this has been associated with vaccination failure. This is a little embarrassing. It's specifically laid out in American protocols to not give it into the gluteal area because the injection into fat rather than muscle has been associated with vaccination failure, and many Americans are obese, especially in the gluteal area. In infants, they recommend the lateral thigh, this is a series of 4 shots. The one that was done back in Pasteur's day, and even up until, I'd say, probably the late 1970s, and for, in some cases, still around the world, is a much worse one, in the sense that it is a series of 26 injections over 28 days, which are shot directly into the stomach. Now, any of you who have recently stayed in a hospital and maybe had abdominal injections of something called Lovenox, which is a blood thinner to prevent blood clots, imagine if you had to get one of those every day, much deeper, with a much larger needle, leaving a big sort of fluid bubble, and you knew that was going to happen every day for a month, and still might not protect you, and you can imagine why. Not the most popular treatment. So these are ones that are still known to work if they reach you in time. So the question is, let's say you didn't get this post-exposure prophylaxis and you didn't know these things. Really, is there anything that can be done? Well, Santhosh is right in that, by and large, this still remains 100% fatal. But there have been about 6 or 7 people who have survived, and I'd like to talk about what was involved in that. And they received a very experimental treatment known as the Milwaukee Protocol. And when I say experimental, we know 6 people have survived who have been treated, and we still not are entirely sure that it's due to this. So this protocol began back in 2004 when a young girl was bitten by or was scratched by a bat. This wasn't found out till later, and this infectious disease doctor in Milwaukee was just as stumped as any of us would be. But after reading a ton, he began to develop the beginnings of a theory, which basically he felt that the rabies wasn't actually killing by destroying the neurons or causing inflammation in the brain. That's how most viral encephalitis infections cause death. His theory went, the rabies really affects neurotransmission, meaning the communication that takes place between cells. And as a result of these cells being overexcited, he thought the disease sends the brain into overdrive, causing its cells to outstrip their energy supply and eventually die. Now, there was some very, very early studies that, would have led him to this, but nothing has been proven one way or the other. However, confronted with the choice of certain death or a theory that we can attempt to do something about, he opted to go for the experimental treatment. So what he created is, he said, okay, this is a disease that sends the brain into overdrive and overexcitation. So he gave her ketamine, which is a tranquilizer and sedative. The original Milwaukee Protocol was ketamine, midazolam, ribavirin, and amantadine. And this was 2 sedatives to keep the patient calm and 2 antivirals, and they put her into an induced coma with the theory that if we could keep her sedated, her own immune system would eventually be able to build up the reserves to fight the infection off. Now, a second version of the protocol has since omitted the use of ribavirin. So since its inception, 2 out of 25 patients survived when treated with the first protocol.
Right.
Okay? 2 out of 10 additional patients survived under the revised protocol. Ketamine he chose because not only would it keep the brain in a state of coma, but a 1992 study on rats showed some small antiviral effects against rabies. So he's like, well, worked in rats. Let's see what happens. So after 31 days of isolation and 76 overall days of hospitalization, this girl survived. All higher level brain functions intact, but she did have an inability to walk and balance and had to really kind of relearn how to do a ton of things again, almost like she had suffered a major stroke or been newborn. Now, an intention to treat analysis has since found this protocol has a survival rate of about 8%. Only 5 people on Earth that we know of has survived a rabies infection after showing symptoms, and they have all undergone this protocol. This is not something that is recommended. It is incredibly expensive. It is not even guaranteed that the protocol itself is having any true effect. It's just, at this point, the only real thing we have. So most of the disease prevention has focused on treating the animals with rabies before they get a chance to bite somebody.
How long do they have to remain sedated for this, out of curiosity? say?
Under the Milwaukee Protocol,
Yeah.
they basically are put in an induced coma until they start showing signs of improvement or die. So it is an indefinite coma. As an anesthesiologist, Praz, how long can you keep somebody on things like ketamine and Versed?
Well, so drugs like ketamine and Versed, we use regularly in relatively small doses without much issue. One of the concerns we have is that these drugs in high doses with prolonged administration or infusion can be neurotoxic in their own right. And so I could sort of see why, when this girl woke up eventually, part of the reason why she may have had some neurologic issues might have been because of prolonged coma. I mean, these days our guidelines tell us to get patients off of sedation as quickly as possible. So understandably, given the circumstances, you do what you have to do, but there's definitely a lot of bad effects that could come out of it.
That's kind of everything we really know about rabies, and really most of the treatment focuses more on prevention rather than anything. So I want to take you back to India briefly, because there's been a couple laws and developments in the country since then that I think you'll be pleasantly surprised to hear about, Koh. And as late as 2015, India's so-called monkey menace was set to become a public finance crisis. There was a show made for Discovery Channel that actually followed around bands of the monkeys at this temple and saw that they were becoming more aggressive. And even all over India, this particular species of monkey, the rhesus monkey, has been a reservoir for rabies, and even when they're not, they're frequently running around biting people and generally making a nuisance of themselves. So India's method to handle this was to put it on the government, and it became a public finance crisis when a high court ruled all victims of monkey and dog attacks who suffered bites have to be paid £2,000 in compensation, which is more than 2 years' wages for most Indians, at least in rural areas. And this happened when, in 2007, Delhi's deputy mayor was killed when he fell from his balcony following a monkey attack. Officials have tried putting monkeys on the pill by mixing contraceptive medicines into food left for them. And my all-time favorite, they deployed larger, more aggressive langur monkeys to scare the smaller rhesus macaque monkeys away. So, of course, it only took about a...
dangerously close to an economic comparison with that. So.
That's even better, as if bringing in larger, more aggressive monkeys to scare smaller monkeys away and drugging monkeys with contraception wasn't going to work. The city came to the realization that this was probably not the best plan after about 6 months. So, what did the Delhi government do? They fired all the langur monkeys, and they actually used the word fired in the article, and then they hired young men dressed in langur monkey costumes instead. Now imagine there is a thriving market for, we would like you to dress up in this monkey suit and run around chasing monkeys away so they don't bite other people. They'll be scared of you because you look like a larger, more aggressive monkey.
Wow, that's awesome.
That sounds real scientific to me.
I could see them having a lot of hazards for being infected themselves.
Sounds like it was taken right out of a Simpsons episode.
We're going to wrap it up with just a very brief, just the tip, one from me and one from Koh, who has been a really good sport about this and who hopefully feels a little more confident in my abilities after all these years. I won't hold it against him if he doesn't.
5% in an hour, that's not so bad.
All right, that's an improvement. So our Just the Tip this week in India is the Temple of Galtaji. Now, Galtaji is where we had actually gone. It's an ancient Hindu pilgrimage site about 10 kilometers away from the city of Jaipur, which is in the Indian state of Rajasthan. The temple consists of a series of temples built into a narrow crevice, and there's several water pools, and each pool is supposed to be holy and provide a different sort of blessing for you. So people will make this pilgrimage and sort of climb up and bathe in each of the pools, which I'll tell you right now, I would not recommend. That water looked filthy for anyone in it. In addition to the numerous Indian people bathing in it, the monkeys have claimed, these rhesus monkeys have claimed large portions of this temple and several of these pools for themselves. And that's led to an association of this temple with Hanuman, who is a major religious figure in Hinduism.
Oh, thank you. So many people mistake him for a god, and you actually, you gave him the right title. Thank you so much.
The temple itself is gorgeous, and as long as you do take whatever appropriate precautions, such as holding any bags of snacks away and out of sight of the monkeys, I would still...
These are intelligent little creatures, so it really, they need to not know that you have snacks. So you can't be like, oh, they saw it, but I'll just, put it in my fanny pack. They will open your fanny pack.
I would still say it is worth going to. Now, if you'd like to view it from the safety of your television without visiting it in person, National Geographic directed a series known as Rebel Monkeys, or Monkey Thieves in Hindi. And it followed around the Galta gang, a 60-strong monkey troop that lives in the Galta temple. That was the monkeys that we interacted with, and I'm pretty sure I saw the one who attacked you, Koh, as one of the enforcers of this troop. You can go back and point him out and be like, that was the man. Now,
Pasteur.
far be it from me to give Koh a hard time for hating monkeys, as it is well known on this podcast that I have a fully justified hatred of most sea life. I'm choosing to call Koh's attacker the monkey named Anoop because it's funny. But they did name every member of this Galta gang. Before we wrap up, Koh, let's go away from India a little bit. Why don't you tell us one of your favorite travel stories from anywhere you've been? Where would you recommend people do go as opposed to monkey-infested Galtaji temple?
I would say the other thing is, I think they've renamed themselves, but when we were in Melbourne, it was called Warbird Adventures. I think it's now called Adventure Flight Company. And our buddy Ward went surfing instead. But I think that was a big miss on his part. So I would say that. Definitely do that if you're ever in Melbourne. Adventure Flight Company. They take you up in I think World War II planes, and the G-force is just tremendous. It's actually kind of crazy. I think that would be number one, and then I'll leave it at one. I'll save the other one for next time.
Nice.
Oh, there's going to be a next time.
Yeah, when we talk about glowworms.
Glowworm.
That wraps up this particular episode of Around the World in 80 Plagues. Thank you so much for coming on and letting us poke a little bit of fun at you, Koh, and for poking fun right on back.
Hey, it wasn't so bad. It wasn't so bad. Good for you doing this for 3 freaking years.
Monkeys to the left of me, monkeys to the right.
As always, we love to hear your comments, questions, and feedback. You can reach us on Facebook, on Squarespace, on Twitter, on Patreon, anywhere podcasts are downloaded. We'd love to hear your reviews, your ratings, and we would love for you to support us spiritually, emotionally, and financially. Included in the show notes are a whole bunch of places you can do that. Our theme music is composed by Rachel Leisure. This show is produced by me, with a lot of help from all my co-hosts and those of you who submit stories. Thank you very much. And until next time, as always, happy travels.
Bye, guys.